So where does this leave us? I think the debate here is public health strategy versus individualised medicine. So I think the thinking of the FDA and the CDC in the States is they want the whole population to become as immune as possible, and they want the kind of treating everyone the same. Whereas the traditional approach of medicine is to look at people individually. So if you go and see a GP or physician, they'll look at you as an individual, whereas community health people tend to look at populations, and this is the kind of tension we're seeing between that. So ideally, every individual would have a blood test. Every individual will have their antibody levels tested to see if they've had natural infection. Every individual will have their B and T cell levels checked to see if they need a booster dose of vaccine. Then if the B and T immune cells were relatively low, they'd have a booster dose of vaccine. If the B and T immune cells were relatively high, they could postpone having another dose of vaccine. But practically, that is simply not going to happen to over 300 million people in the United States. It is just not going to happen. It's not going to happen to the 64 million or whatever it is, 66 million people who live in the United Kingdom either. It's simply not going to happen. So pragmatically, it seems that governments are saying, well, we need a one-size-fits-all. And I can understand that argument. So you can decide whether that argument is better. It's kind of a utilitarian argument. It's arguing the greatest good for the greatest number. Whereas the individualised bespoke medicine approach would say, well, no, what is right for this particular individual? And let's tailor a bespoke vaccination programme or non-vaccination programme for that particular individual. But given that that's not going to happen, you have to decide which is most appropriate. But the balance of evidence is that people that have had, my conclusion, I've been looking at this most of today, the balance of evidence is that people that have had the natural infection have greater levels of immunity than people who had the vaccine alone versus natural infection alone. People that have had natural infection followed by the vaccine have even higher levels. And we don't know yet, but I predict that people that have had the vaccine followed by natural infection will also have even higher levels of immunity.